Hi, I'm Dr.Ashima Gulia, Senior Consultant, Obstetrician and Gynecologist practicing at Cloudnine Hospital, Kailash Colony, New Delhi. So bleeding in pregnancy can be due to many reasons, and bleeding in pregnancy can happen from very early in the pregnancy till towards the end of the pregnancy also. So the first time when there can be bleeding in pregnancy is during the implantation of the fertilized embryo, which is called as implantation bleeding. This bleeding can coincide with your expected due date. So many patients who have had implantation bleeding doesn't realize that they have conceived and they think it was their normal period, and later on they get to know that they were pregnant. So this is the first bleeding, and patients also can have bleeding in their first trimester. It can be spotting, it can be massive hemorrhage, it can be moderate bleeding also. So when a patient comes to us with bleeding in the first trimester, the first thing we do is ultrasound to confirm the presence of the fetal heartbeat. Once we are sure of the presence of the fetal heartbeat, the patient is put on bed rest and other supportive measures to prolong the pregnancy. And let me assure you, bleeding in first trimester is relatively common and nothing to be worried about. And we have seen many cases where all these pregnancies have continued to progress well and continued till term, and we have delivered healthy babies. So bleeding in first trimester can be a cause of panic and worry, but it can be definitely managed with all medical support and the pregnancy can continue well. Moving on to bleeding in second trimesters, it can be due to low-lying placenta or abnormal placental position or cervical infection or presence of a polyp, which again can be ruled out after examination and after doing ultrasound scans, and accordingly based on the cause of the bleeding it can be managed. Bleeding in the third trimester could be a cause of concern, which means it could indicate placental abruption or bleeding from a low-lying placenta, which will require immediate attention if it is heavy or massive. So all bleeding in pregnancy is not to be thought of something dangerous. It can be managed with the right medical support.